Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, podcast endorsed and sponsored by kidneysolutions.org.
Hello, everybody. This is Kent Bressler. Doing some podcasting today. I got a great guest. I just wanted to let you know, and I had my MRI done, and I'm cancer-free. Evidently, the procedure they did to take out the tumor on my transplanted kidney, or my brother's kidney, was successful. So I'm walking around telling you I'm good. If you don't believe me, just ask me. I'll tell you. Okay, so let's get started with prayer this morning. Lord, sometimes we feel lost and uncertain of our purpose. Please reveal to us the gifts and the talents you've bestowed upon us. Guide us towards our true calling and help us serve others with love and compassion. And let our actions align with your divine purpose. And may we find fulfillment and joy in serving you. Thank you for your loving guidance and your constant presence in our lives. And bless those who now are searching for a living kidney donor, or those who are on dialysis, anybody who has chronic kidney disease. We pray for you that you give them relief, give them peace, and give them hope. We ask all of this in your holy name. Amen. Okay, folks, here we go. This is something I've been looking forward to for a good while. I have Josie Meyer, who is the co-director of a project called Project Donor. It's a nonprofit organization dedicated to providing free resources to living donor candidates to help them overcome barriers to donation. Project Donor is housed at the University of Chicago Center for Research Informatics, which is a think tank. I think that's a misnomer, but I believe it. It is a think tank and a nonprofit incubator. It was founded by Dr. Stephen Levitt. He's the co-author of Freakonomics, and Josie is excited to continue her work supporting living donors and their path to donation with free, I repeat, free comprehensive care. Now, let me tell you something. We've decided at Kidney Solutions, and you know you can go to kidneysolutions.org for any information about us. We've decided to line up with this gal and with this project. And I can tell you what, it's going to work. It's going to work really well, and it's going to be a benefit to anybody who out there who wants to sign up to be a kidney donor. And trust me, it's going to be a good background for you to figure out whether or not you want to be a kidney donor. So let's get started right away. Josie, good morning.
Good morning, Kent. Thank you for having me.
You know, I was thinking the other day how hard and difficult it really is. We have so many patients with us that are searching for a donor. All right, some of them are on dialysis, some of them are waiting preemptively to get a donor so that they can do this without going on dialysis. So the importance of your work, it can't be explained. But I can tell you what, I want you to start out and just tell me, how do we frame this organ shortage business? How do we deal with organ donation?
Of course. Yeah. So most of the time you hear about the organ shortage as a shortage of willing donors. But here at Project Donor, we like to reframe that. We know that there are thousands of people that are willing to donate a kidney to a loved one, but in fact, only 98% of people who start the process of donation never make it to surgery. So only 2% of people ever make it. Yeah, it's crazy. There's so many people that are being ruled out. And according to our estimates, around 14,000 people are being rejected each year for what we call mutable or reversible issues. Now, these are issues like missing the BMI cutoff, so you have to be a certain BMI in order to donate. It could be things like smoking or having a history of smoking, being on the cusp of high blood pressure or having any blood pressure concerns or having some mental health concerns. But notably, with all of these, especially BMI, which is one of the biggest rule outs for organ donation, these things are reversible. You can do something to overcome these barriers and actually go on to donate. So what Project Donor does is it targets this 14,000 people, this target audience of people that want to donate, but that have been ruled out of donation for these reversible reasons.
So people step forward to donate, got to get it in their heart, and they get a call.
Yes.
Whatever it is that floats their boat, they're going to do it. But the barrier is not so much in asking. The barrier is going through the process, right? And
Yes.
that's not always easy, but it shouldn't keep people from trying. They'll say they do
Exactly.
have an issue. So what? Let the transplant programs tell them that, and then we can pick up with it. We can pick up with
Absolutely.
Project Donor and help them. Okay, let's talk BMI. Okay, let's talk. What's the unspoken barriers that you've come upon with BMI? Explain that.
So with BMI, there seems to be several concerns with it. One seems to be that there is the risk of going on to develop diabetes or any weight-related problems in the future post-donation. And post-donation health is a big concern of the transplant team.
Sure.
Understandably, we want to make sure that the donors are healthy post-donation. But with BMI, we know that BMI is not a perfect measure of healthiness. Far from it, in fact. But usually we see at centers, there's a BMI cutoff between 30 and 35. So when you're a donor, what you'll do is you go online and you fill out an application to be a donor at a certain transplant center. And every transplant center has a little bit of a different BMI cutoff. So what this means is that at one center, if you have a BMI of 32, you might be rejected from donating, but at another center, their BMI cutoff might be 35. And at that center, you might be able to donate. So what this means really is that the BMI cutoff is an eligibility barrier that can rule you out in the initial phase. You just filled out the application and you can be automatically screened out.
You're gone.
You're gone. You're out of their system. They don't bring you into clinic. At some of our partnered centers, what we've had them do is add a automated message that will pop up about Project Donor if someone is auto ruled out for BMI, and it will say, "Hey, you've been ruled out for BMI, but you can join this program called Project Donor. They can give you some free resources, and you can get that BMI down, and then we can see you in clinic." So this BMI barrier, it accounts for about 90 to 95% of the people on our program. So this is a little bit over 300 people on our program that are dealing with this BMI barrier. Yeah, it's undoubtedly the biggest barrier that we see to donation.
I think that's the way it is with Kidney Solutions. When we get donors in, that's the first thing they say. Well,
absolutely.
I got rejected because I'm too fat. Period.
Yep.
They tell you that.
Yep.
They don't use the word obese. They just told me I'm fat. But I want to lose the weight. We don't have the opportunity to do that. We have, people that will work with them, but having Project Donor, having you, Josie, being able to refer to them, that's what Kidney Solutions is going to do. So this enhances our program, and it's for free.
Yes, completely for free.
Okay.
Free.
So when we get to this point now, what is it that you do to help bring this biomass index down? And is it true that if a person who, say they're told they got to lose 30 pounds, all right, you have to lose 30 pounds before we even consider you. If they start trending down and they get to 20, can't they go ahead and just reapply and say, hey, I've lost 20, and the programs usually will look at them because they know they're motivated? Is that true?
So what I would say is that if a donor shows motivation and trending towards a lower weight, I think that the transplant centers team is much more open to potentially bringing them back in office and starting the process of testing them more. So what we're kind of doing at Project Donor is we're trying to, in our new phases, establish a better frame of communication between ourselves and the transplant centers so that we can say, hey, this participant that intends on donating at your center, they've lost 50% of the weight that they need to
Yes,
donate.
yes,
So how about you reach back out to them? How about you bring them back into clinic?
yes.
So
That's
we're
what we need.
trying to, absolutely, we're trying to get this line of communication to make sure that our donors that are doing the hard work to make it towards donation are being actually reconsidered for the process.
Okay, so that's the goal, and that's how BMI
Yes.
works, and that's how we're going to work. Our patients are all of our patients with BMI issues or other issues, which we'll go on to explain, are going to go through
Mm-hmm.
this program. All right,
Absolutely.
and we're gonna we're gonna be very. We've already started referring patients to.
Mm-hmm.
Okay,
Mm-hmm.
so that's a given, and so Kidney Solutions looks at this as a win-win for everybody. So
Mm-hmm.
we're going to continue on. Okay, so kind of give us an overview of Project Donor. Kind of spell it out for us. We hit on BMI because that's the most important thing, but
Exactly.
you know, give me an overview of what we're talking about here at Project Donor.
Yeah. So, as you explained a little bit in the beginning, Project Donor is a nonprofit organization that was created around this idea of helping donors that have been ruled out of donation get back into the process. So, what we do is we give people free resources to help them overcome whichever barrier to donation that they may be facing. So, we currently have a couple programs on Project Donor that people can join. We have our weight loss program, which of course is the most popular as it is the biggest barrier that we see to donation. So what we offer for weight loss is we offer free subscriptions to Noom and Weight Watchers, which are both commercial weight loss and nutrition programs. We also offer free scales to all of our participants. And we are now creating partnerships with a couple schools to have nutrition master's students acting as one-on-one nutritionists for free for participants on our program. So we're really excited to be rolling that out in the next
There you
couple of
go.
months.
Yeah.
Yeah, we're very happy about that. We think that this could be really great, especially for participants that maybe need a little bit of higher touch or more lifestyle changes in order to lose that weight. Then, other than weight, we also offer programs for smoking. So, smoking cessation is a barrier that, like weight, kind of changes from center to center. But what you usually see is that participants have to stop smoking for 6 weeks to 3 months prior to
I
donation.
heard a year too.
Yeah, it's
It's
it's crazy
very,
how all of these barriers are so variable at every different center.
it's a
But what
nightmare.
we offer, it's a nightmare. It is a nightmare. What we offer is free nicotine replacement therapy. So we have partnerships with Nicoderm and Nicorette, and we provide free gum, patches, and lozenges to people that need to stop smoking in order to donate. Then we also have our mental and socio-emotional support side of our program. So we do offer one-on-one therapy through BetterHelp. It's an online therapy platform where you can have telehealth therapy from anywhere. We know that donation, it's an incredibly taxing process, not only because, I mean, you're going to go through a major surgery, but because presumably you also have someone in your life that is suffering from chronic kidney disease or is on dialysis, whatever the case may be. We want to make sure that we're supporting donors leading up to surgery. And also, I want to mention that we offer all of our resources for free a year after donation as well. We think that this point in time, from what we've heard, is when donors feel rejected or almost tossed to the wayside by their transplant center
Oh, it's
because
true.
they've already donated.
Yeah, it's
And
true.
what we want to do is we want to make sure that no donor feels like they've been left behind. And we want to make sure that they've maintained these health strides that they've made prior to donation, post donation.
See, this is part of the planet in our mentoring organization at Kidney Solutions. We have a three-pronged. We help them try to find a donor, okay? Then we're
Mm-hmm.
there when they get transplanted on that day, either remotely or in person. And then the biggest part is that we follow them. We follow them closely afterwards and keep them on track. Not we're a supplement, and this just allows allows more coverage for them, gives them a better chance of success. We know we get out a year, we get out 5 years, we get out 10 years. That's big deal. And that's what
Absolutely.
program that will work. So,
Exactly. Exactly.
so your founder had a personal experience. Tell me a little bit about that.
Yeah, so as you mentioned a little bit before, Project Donor is housed at a think tank called the Center for Risk. We're housed at this think tank at U Chicago. And what Project Donor originally was a pilot program. It started as an idea. And this idea I've already explained, but in the past 2 years since we've been running, we've really scaled the project to be more than we could have ever imagined. But it all started with Steve. So Stephen Levitt is the founder of the Center for Risk.
Yes, ma'am.
And about 20 years ago, he had a really unfortunate encounter with organ donation. His young son, Andrew, passed away very suddenly at the age of 1, and him and his wife decided to donate Andrew's organs, which turned out to be a pretty convoluted process. And ever since, Steve has been trying to do something to help reform organ donation. And so that's kind of the basis on which Project Donor was built off of. And we've been really happy to say that we've actually been able to support 77 living donations since we started the program 2 years ago. And so I think that we can say that we've been starting to achieve this dream that
Oh,
Steve
sure you
had.
have. Absolutely.
Oh yeah. Yeah.
Absolutely.
So we're very happy.
I think the highlight of this whole thing is getting dug in. I mean,
Hmm.
process to donate, like you said, is fraught with danger. The biggest thing is finding people that are interested. I don't think the first of all, I don't think the country in itself understands the fact that you can survive with that, with
Hmm.
just one kidney. My brother's done it for 38 years, done very well at it
Hmm.
for 38, and I've done well with one. All right. The
Hmm.
whole process, though, is getting them to the altar, so to speak. The donor is the one that really trips the switch. If we don't have
Hmm.
a donor, we're not going anywhere. We're waiting. And waiting is a bad word with kidney disease because when you wait, you die. Okay. And unfortunately, there's only three ways to go. And that is, get a transplant, go on dialysis, or a combination of those two, or palliative care because
Hmm.
it is lethal. The disease process is lethal. That's hard to say. I said it. It's true. You live it, and I've lived it my whole life. My point is, if somebody wants to step forward and become a donor, they have lots of questions. I mean, their mind is just racing. Oh God, I want to do this. I'm being called to do this. Something's telling me I want to do this, but I don't know anything about it. And that's the common denominator for every person who wants to donate a kidney or part of a liver, whatever. But that's the whole process, and that's got to be dealt with up front. That's an upfront thing that needs to be dealt with because if they don't come forward, we can't use them. People die
Absolutely.
every day waiting for a kidney. So,
Absolutely.
so when you look at it from that something's got to be done to free up some of these donors. Have you
Hmm.
thought through that? Is your think tank doing something about, getting the call out because it's not coming out? Is that something
Exactly.
that really needs to be addressed? And everybody says, well, the government ought to be involved. Well, yeah, they can be. Okay, they can be. But the point is, it's overshadowed by everything else.
Hmm.
The thing of it
Hmm.
is, there's got to be a concerted effort by the public to have an understanding about not kidney disease so much, but what it's like to donate and what it does for people.
Absolutely. So I think we have been thinking about, kind of as you said, getting this call out more in terms of just publicizing that this is even a thing that you can do. I
Yeah,
mean, most people don't think about kidney disease or donation as a thing that can be a monumental part of their life. Even if you don't know anyone with kidney disease, you can donate undirected. I mean, there's a bunch of options for people that want to save a life. And it is kind of crazy to me that it's not something that's more talked about. So what we've
Exactly.
been doing is we've been coming up with a couple projects, so to say, to kind of work on getting this word out in a way that's most palatable to the general audience, I would say. So we've been tinkering around with the potential of a docu-series that would center directly on kidney donation and kind of feature this issue of eligibility barriers to donation as one of the biggest challenges that these donors are facing in order to save a life. And so that's one of the big projects that we have kind of we're formulating and getting right. We've also been trying to amass some sort of a social media presence so we can get more of the word out. I would say that most of our education comes directly with the patients that we work with.
Right.
So on our program, we have one-on-one case managers. Every single person that joins the program gets a case manager, and this case manager is there to support the participant, give them information, give them our resources, and kind of just act as a cheerleader for them throughout the process of donation, before and after. And so I would say our main form of kind of mentorship and education is coming directly with these kidney donors.
That's what we're that's what we're doing with the recipients. And
Yep.
and then so we get to turn some of these donors, potential donors, over to you. Okay,
Hmm.
that's the beauty of this whole project. And it
Absolutely.
just come over me over the time that I've known you that this is something that it has to take off. It has to,
Hmm.
because there are too many people dying waiting on kidneys. Way too many.
Exactly.
And kidneys are the most plantable organ in the country.
Hmm.
We do more kidney transplants than anything. And thus the need for them is even higher than is expected. Think of what,
Hmm.
90,000 people right now on the waiting list?
Yep.
90? That's 90,000, not
Hmm.
9,000, not 900, not 90,000 people waiting
Hmm.
for a donor. Whether they wait to get a deceased donor or they are fortunate enough to start early and preemptively get a donor, a living donor, there's a lot to learn about this, and it's scary for people who may have thought, but we can fix that. All right, we can
Hmm.
fix it through. Just give us a call at Kidney Solutions, and we'll put you in touch with somebody who can counsel with you. We can talk with you.
Hmm.
We can help you with that. And donors the same way. There's always an avenue. We now have an avenue through this Project Donor. I think
Absolutely.
it's a wonderful thing that we have to do. And so
Yeah.
give me some highlights here. And you talked a little bit about your results, but where are we going with Project Donor, and how can Kidney Solutions and how can the public help you with this? This is a big deal. All right. I'm all
Absolutely.
in.
Anyone that the listeners out there know that is thinking about becoming an organ donor or is trying to donate an organ but is facing any barriers, we would love to try to help them. You can go to our website at projectdonor.org and schedule a meeting with one of our case managers. They'll be your cheerleader, they'll help you through this process. But in terms of the whole of Project Donor, so since we started about 2 years ago, we've actually onboarded over 860 participants. So a lot of people for a short amount of time.
Oh,
And we currently
absolutely.
have around, as I mentioned a little bit earlier, over 300, so closer to 400, 380 participants active on our program working towards donation. And so in terms of donations, we've actually seen 77 donations over the past 2 years, which is 77 individual lives that we've been able to help save. And what that is compared to other transplant centers, we actually have 8 times the national average in our donation rate. So our donation rate is 16%. 16% of the people that have been on our program for 1 year are actually able to go on and donate, which is, as I mentioned, 8 times the national average with a 2% to maybe 5% donation rate. So we are very excited to be able to
Absolutely.
offer a comprehensive care package completely for free to participants that has been proven to be able to support people towards donation.
Okay. So there it is, folks. I, I'm going to give you a chance, Josie, to
Of course.
just tell me what it is needs to be done right now, because we're gonna finalize this. This is information that people get real quick here. And if you have
Hmm.
anything else you need to say, let's do it right now.
Of course. Um, in terms of just getting the call out from our donors, we've heard that this is a life-changing, not only for the recipient, but a life-changing experience for the donor. You are able to save someone's life by being able to donate. And kidney donation is an incredibly safe surgery. The long-term risks are minimal. You will be okay. As Kent has mentioned, his brother donated him a kidney, and he's been living great for 38 years. I mean, there's so many stories like this. And if Kent didn't get that kidney, I wouldn't be able to be
I'm a
here
dead
talking to
dog.
his lovely face. We need more kidney donors, and any barriers that you're facing towards donation, such as weight loss, such as smoking, mental health, whatever it may be, Project Donor is happy to support you in getting to donation. I'd also like to mention some maybe of our unsaid barriers to donation. This goes out to all the donors out there that are starting this process. I think that we need a little bit more transparency in what exactly might rule you out or make you a less attractive donor. So, what I'm going to talk about is what I am calling signaling barriers. Now, what I mean by this is there are certain things that a donor can do that signal their fitness as a donor. What this means is, let's say one of these barriers are primary care physician. So when you're donating or going in to donate, they're going to ask if you have a primary care physician. Now, from the transplant center side, they would like you to say that you have a primary care physician because this tells them that you have what's called a commitment to your health. Now, this is very important because
Oh,
post
absolutely.
donation, you're going to have follow ups and you're going to have to monitor your health to make sure that there are no complications and that you are doing well. So this is undoubtedly something that is very important. But I think that to the donor side, I mean, I can imagine situations in which a donor is thinking, I'm healthy. I don't have to go to a primary care physician. I haven't had any health problems, so I'm okay. And so they don't put down that they have a primary care physician. And that would signal that you're maybe not as fit as a donor because you don't have this commitment to your health.
Yeah.
And that's not
Not
even
paying attention
considering
to your health. Yeah.
exactly. It's not even considering any structural barriers, such as financial barriers or a lack of insurance that might be barring people from having a primary care physician. So at Project Donor, we've tried to work around this barrier as well. My wonderful co-director, Daniela Schumann, has been working on creating an algorithm that will automatically be able to tell participants who say they don't have a primary care physician where free clinics are in their area, and they can go and get a free primary care physician. So that is one barrier that's kind of unsaid, but we're trying to work around it. Another one that I've seen that I just want to mention real quick here is what I call the communication signal. And so we're kind of on this scale between two extremes. You could not contact the transplant center at all, or you can contact them what may be considered too much. So when someone's working on losing weight or doing whatever they need to do in order to become a donor, eventually they have to go back to the transplant center and say, hey, I'm ready to donate. So if you're not taking that initiative to show that you're engaged in this process, regardless of if you're doing the hard work to lose the weight, to quit smoking, whatever, they're going to say, maybe this person isn't as eligible or fit to donate because they don't really seem that committed. But on the other hand, if you're communicating with them too much and seeming too eager, they might also be hesitant to allow you to donate or to work with you.
Yeah.
So we're in this middle limbo ground that you have to get to in order to seem like an attractive donor. And so both of these, the primary care physician signaling, this communication signaling, these are kind of squishier barriers than a strict BMI cutoff, but they could absolutely impact your fitness as a donor in the eyes of the transplant center.
Right. And so that's something that that you're going to work with them. That's why it's
Absolutely.
important to get. If you're out there right now and you're thinking about, gee whiz, this sounds like a great idea. I want to do it. And you contact us at Kidney Solutions, or you contact Josie. However, we can get you to Josie. Point is
Yes.
what you're thinking right now is right. It is correct. The only thing you
Hmm.
need to do is get a hold of us so we can direct that thought process and make it come true. And that's what Project Donor does. All right. You have
Absolutely.
qualified people who, with experience, that are free. And everybody says, no, it's not. Yeah, it is free. And you know what? You've got two organizations here now with the best intentions for you as a donor, and all you got to do is call. All you got to do is go to
Absolutely.
kidneysolutions.org and say, hey, I want to talk to Josie. All right. Or I want to talk to Project Donor. But you got to do it, because if you don't, you lose an opportunity. And if you do, if you just decide you don't want to be a donor, and a couple months down the road, a year down the road, you're thinking, you know what, I'm going to do this. We're going to be here. We're going to be here for the duration. All right. We're not going anywhere. And so we're always going to be available to work with you. I don't see any other way to this increasing the amount of donors unless we're available, and we will be. All right. And that's the way it's going to be. Right, Josie?
Yes, sir. And we are completely free. I can't get that
I
across
can't know.
enough. It is completely free to be on our program. And you do not need insurance. We won't check. You don't need to be a legal resident of the United States. It's completely free. There are no strings attached.
Exactly. And the same way at Kidney Solutions. What better marriage could you have, two organizations that
Hmm.
are free? I mean, nothing. We don't even bill. No one takes a salary. No one did,
Hmm.
we're talking here. It's all about the patient and the donor, the recipient and the
Hmm.
donor, and we're focused on them. All right. And whatever it takes to make it a comfortable transition to where they can feel free to donate, we're all about it. All right. And
Hmm.
you know what? If it's in your heart right now, if you're thinking about it, I would recommend you go to kidneysolutions.org, or get a hold of me at 830-285-2140. That's 830-285-2140, and we'll start the process. Real simple. And guess what? You're going to save a life.
Hmm.
Josie,
Yes.
thank you.
Thank you so much, Kent. This has been wonderful.
We are going to use this, and this is something that we will always think about, is how do we get more donors into the space? How do we get them into the ingredients to make this a success? Because there are people out there waiting for a kidney, and people dying waiting on kidneys.
Hmm.
So, okay, folks, listen. I can't say it enough. What a joy it is to be back in the saddle, and what a joy it is to have one of my first guests been Josie Mayer from Project Donor. Come on, let's do this. Let's think about it, pray about it, and be steadfast in your belief that whatever happens, it will be okay. Trust me. And till we see you all again, keep breathing.